talk briefly about some unusual ectopics, including abdominal pregnancy, cornual ectopic pregnancy, cervical ectopic pregnancy, heterotopic pregnancy, and cesarean scar implantation. Abdominal pregnancies are situated in the abdomen, outside the uterus and outside the tube, just free in the abdomen, typically up right against the intestines. These are usually, but not always, that easy to distinguish from intrauterine pregnancies. Here's such an example. This is a 15-week pregnancy. 15-week pregnancy, there was a live embryo, there was a heartbeat on another view. Here's the pregnancy, and at first sight, this patient was experiencing very extreme pain. At first sight, the ultrasound could be interpreted as showing an intrauterine pregnancy. This could be interpreted as the cervix, and this as the intrauterine pregnancy, with no explanation for her pain. But when we looked a little more carefully, you could see that this was actually the whole uterus. When we moved the transducer a little bit, there's the top or the fundus of the uterus, and this pregnancy is just sitting free in the abdomen. Cervical ectopic pregnancies are ones that are implanted in the cervix, and there the potential difficulty is separating it from a spontaneous abortion in progress. The difference, we diagnose a cervical ectopic, one that is implanted in the cervix instead of one that's passing through it, is if we see a nice well-formed gestational sac with a nice bright ring around it, especially if we see an embryo with a heartbeat. If we see a flattened sac without a nice bright ring around it, no embryo or heartbeat within it, we diagnose a spontaneous abortion in progress. So if we see a well-formed sac with a prominent bright or echogenic rim, especially if we see a live embryo, we call it a cervical ectopic. If it's a flattened irregular sac, thin or absent rim around it, no live embryo, we call it a spontaneous abortion in progress. If it's equivocal, we're not sure which of these two it is, and the patient is clinically stable, we'll wait 1 or 2 days. If it's unchanged, we'll call it, we diagnose cervical ectopic, and if it's gone, it's a spontaneous abortion in progress. And these are examples side by side. There is transvaginal view of the uterus, and here's the cervix. Nothing in the body of the uterus. In the cervix, we see a gestational sac with an embryo and heartbeat. This is a very well-formed sac with an embryo and heartbeat. The only problem with it, it's a big problem, is that it's in the cervix. This is a cervical ectopic pregnancy. Here, on the other hand, we see another transvaginal view, nothing in the body of the uterus, a flattened sac in the cervix. There's not a bright rim around it. We see a little yolk sac, but no embryo. This is a spontaneous abortion in progress. And here's one where we weren't completely sure. This woman was having pain and bleeding, nothing in the body of the uterus on this transvaginal scan. Here in the cervix is a gestational sac. We weren't quite sure whether it was a pregnancy implanted here or passing through it, spontaneous abortion in progress. So we said, let's scan again tomorrow. She was stable. The next day it was all gone. So this was a spontaneous abortion in progress here that had cleared out. When we're trying to diagnose cornual ectopic pregnancy, the challenge is distinguishing a cornual ectopic pregnancy from a intrauterine pregnancy that is located off to the side or eccentrically located, or an intrauterine pregnancy in a duplicated uterus like a bicornuate uterus or a septate uterus, in which you have 2 horns, one with the pregnancy and one without the pregnancy. There's some similarity in appearance of all these, and I'll show you examples on ultrasound in a minute. The key difference, we diagnose a cornual ectopic when we see no myometrium. Myometrium, or the muscle of the uterus, looks dark compared to the tissue around the gestational sac. If we see no myometrium and bulging of the edge of the uterus, we call it a cornual ectopic. So if there's an eccentric gestational sac with little or no visible myometrium, which shows up as hypoechoic tissue around the superior or lateral aspect of the gestational sac, we call it a corneal ectopic. And if there is myometrium around the entire gestational sac, it's an intrauterine pregnancy. A few examples. Here is a corneal ectopic pregnancy. We have, here's the uterus. The pregnancy is way off to one side. There's bright tissue around it, but then there's no dark myometrium around the outside. And we see it again here. There's the heartbeat, there's the main body of the uterus, there's bright tissue around it, nothing around the far edge. That's a corneal ectopic pregnancy. Here is another patient. She has something that looks quite similar. The pregnancy is way off to one side. This is a coronal or transverse view. But there is myometrium all the way around the outside. This is an intrauterine pregnancy in a bicornuate uterus. Here's another corneal ectopic. This is in the left horn of the uterus, the left cornua of the uterus. Gestational sac, bright ring, no dark myometrium. It bulges the edge. Sometimes we can get a more clear-cut or definitive view using 3D, three-dimensional ultrasound, and here on the three-dimensional ultrasound, that's the fundus of the uterus. There's the left cornu or left horn of the uterus, and that's where the pregnancy is. It's not inside the body of the uterus. This is a corneal ectopic pregnancy that we were pretty sure of on the regular ultrasound and become completely sure on the 3D ultrasound. Here is a case where it's not so easy to tell. We have a pregnancy, it's way off on the side. There is little or no dark myometrium around part of it, but it isn't really bulging the edge of the uterus. If we're not sure, we should always wait, because the last thing you want to do is damage what might be an intrauterine pregnancy. In this case, we were very glad we waited. We actually, a few days later, did a 3D ultrasound. This is the same pregnancy sac as that, way off on the side. But you can see on some of these extra views from the 3D ultrasound that it looks like there is myometrium all the way around it. And we were glad we waited. At 13 weeks, it was a nice normal intrauterine pregnancy. So from the last two cases that we saw, it's not always so easy to tell. This one looks something similar to that one. This was a corneal ectopic. This was an intrauterine pregnancy. So we have to treat these with great care. If we're not sure, we get a follow-up ultrasound a day or 2 or 3 later, which will usually give us the answer. So I've come to the end of the tour. I've looked at some of the basic rules for diagnosing ectopic pregnancies, some of the pitfalls in diagnosing tubal ectopic pregnancies, and some of the rules for diagnosing unusual ectopic pregnancies. I hope that it's been very useful to you in seeing how we make the diagnosis of tubal and unusual ectopic pregnancies. Thank you.